we stay at home, and then we turn on the radio, we turn on the TV, and all of us expect you guys to still be on radio.
Yes,
Everyone expects radio to be on.
I know. One of these days, all radio
and all of that.
One of these days, all radio stations, two stations should just go off for shaggy reasons.
I can suffer. So thank God to you guys. Keeping us company and keeping us going during the very, very difficult first few weeks. And yes, I've been away from here, but it's been work and. It's been tough, but
how's it been at Medicals dealing with COVID-19?
Initially, it was a bit scary. This whole thing was was very new to all of us. I don't think anything has hit us in this way before. The closest was Ebola, but Ebola didn't really make an impact in this country. So we were watching it from a closer distance. So in terms of the principles of public health, dealing with a very infectious disease, we're always aware of those principles, but in actually having to deal with it and knowing that the patient sitting in front of you might be suffering from COVID-19, it was a bit difficult, and every single day new things kept coming in and guidelines, and because this whole thing is new, and a good reason they call it the novel coronavirus. So initially it was a bit difficult training the staff to let everybody know how to properly social distance and how to triage the patients and know who your suspect case is and the reporting systems and so on and so forth, especially when we had a few suspect cases. And what do you do, and how do you cope when you don't know that waiting period, when you're waiting for the test result back from Noguchi, and another hospital or next door would report something. It was a bit anxious, but I think now we've all become quote unquote a bit comfortable dealing with. I guess
we're adjusting to how to manage life with COVID-19.
Exactly, and I think gradually with the knowledge, increasing knowledge, and then we are becoming more and more confident about what to do and how to actually do it. And I think for us health workers, I think that's the most important thing.
Thank you to you and other health workers who have been at the forefront, making those big sacrifices on our behalf. We appreciate you guys tremendously. And our discussion this afternoon also is in line with exactly what we're just talking about, which is COVID-19. Now, we've heard severally a term, pre-existing conditions. And you don't know.
Actually, lots of terms have come up. We've been thrilled because for the first time, we health people have had a front line. There used to be a lot of politics and football. So we've introduced a lot of terminology into the system, and pre-existing conditions is one of the things that people have come across.
So for those that probably haven't had the proper understanding regarding pre-existing health conditions and COVID-19, what exactly do we mean by pre-existing conditions?
Right. So, Sammy, today that's what we're going to spend the next maybe 15 or 20 minutes talking about. And before I go on, good afternoon to all our listeners, and it's always good to be back. Hopefully, we get on with our lives, doing all health issues besides coronavirus. But yes, we're absolutely right. A lot of different technologies have come up. Different phrases have also come up: social distancing, quarantine, self-quarantine, supervised quarantine, reproductive number, and so on and so forth. But
hand sanitizer.
Different ways of pronouncing that. So today I wanted us to have a discussion on pre-existing conditions.
Okay.
What do we mean by that, and how does that impact the severity of COVID-19 in an individual? Because people need to understand that, especially now that we've entered the new phase, stay alert. That's a new mantra. It's going to put a lot of responsibility on us as individuals in terms of the choices that we are going to make, where we're going to go. So on last Sunday, the president eased some of the restrictions. So they're putting the ball in our court. And if we listen to the ministerial press briefing that gave the details about how this needs to be implemented, you realize that they gave some caveats, and one of the caveats about going to church or the mosque or gathering was that those with pre-existing medical conditions should stay away even from the church. So I mean, a pre-existing medical condition is any medical illness and situation in an individual that predates infection by the coronavirus that increases the person's risk of developing a severe or critical form of the illness. So importantly, I would remind listeners that this virus, once it affects you, there are 4 main manifestations. One, the first one is that the person may be asymptomatic. When we say asymptomatic, it simply means without symptom. So most people in this country who have had the virus have been or are asymptomatic or have mild symptoms. Okay, that's the big category of patients. They have very mild symptoms or be totally asymptomatic. Then a few people can go on and develop what we call a critical illness, where they would require a hospital admission, isolation, and then the use of oxygen, amongst other things. Then you would have that's severe, and then you can have the critically ill who will need ICU care and probably the use of a ventilator. Yes. So these are the 4 categories that you might have. If you are asymptomatic, nobody would know. We'll use the thermometer gun to check your temperature. It will be pretty normal. You will not have any cough, no cold, no sore throat, no difficulty in breathing, nothing. So until we take a throat swab from the contact tracing team, or for some reason a sample is taken, then we would never know. Then those with the mild symptoms will have a bit of a cough, the sore throats, and so on and so forth, and most of them would recover. So if you look at the rate of recoveries in this country, it's very, very impressive. Quite a huge number. I think the last time I checked, well over 2,000 people have recovered from the illness. Most also are being treated in their homes or designated places, and they're out of hospital doing that. Means all those people probably have very mild symptoms, with very few in hospital, severely ill, needing oxygen supplementation amongst others, and then ICU care. So when we talk about the pre-existing medical conditions, then these are medical illness or diseases that predate the individual had it before the virus infected them, or certain situations, and I'll mention when we get onto it. I'll give you examples. So not only medical condition, but in certain situations, as I call them, that predates your infection, that would increase your risk of developing a much more severe form of COVID-19. So that's what we mean. So because of that, then those individuals need to know, and for them, even when we ease the restrictions, even when we get to the latter phases of this phased lifting, of restrictions, then those individuals will have to be very careful. They still will have to be very, very cautious and maintain all the guidelines: the hand washing, the use of the face mask, the social distancing, and still not going out unless it is absolutely necessary. So, Sammy, let's look at some of these pre-existing medical conditions. Some of these medical conditions will directly affect the parts of the body that this virus affects. So by now, most of us know that the coronavirus would primarily attack the respiratory system, the pathway, from the nostrils all the way down into the lungs. And once it gets into the lungs, then that's where the infection takes hold, and then it compromises your breathing ability. But then there are a lot of conditions that these pre-existing medical conditions or situations don't necessarily affect your lungs or your respiratory system. So then how then does it increase your risk of getting a severe form of the disease? I would explain. The first thing is diabetes. Most people in this country know about diabetes. Maybe sometimes we call it the blood sugar disease. So diabetes is a disease that affects your whole system, if you like. the regulation of blood glucose or sugar is impaired. Diabetes has an overall effect of reducing your immune system's efficiency or efficacy. So your immune system becomes less efficient, and it is the immune system that primarily leads the fight in recovery from COVID-19. So I'm sure over the period we've all heard about things that we can do to boost our immune system. So a lot of local things have come to the fore. Kontomire, dawa. I had the president mention that they are. I was quite impressed when he gave us a tall list of local foods that help boost the immune system. So diabetes as a disease condition weakens your immune system. Your immune system partly is made up of your white blood cells. So when we take your blood, we say, the white blood cells. The white blood cells are the soldiers of your body, and they would move in to attack foreign things that enter your body. So coronavirus will be looked at as a foreign body. But diabetes has a way of slowing down the movement of the white cells. So the white cells don't stay in one place. They move all over your body to attack things. So diabetes causes what we call a slow white cell syndrome. Where they are very, very slow. So sometimes we all complain that fire service, there's fire, you call them and then it takes forever for them to get there. So they eventually get there, but then it takes forever. So same thing happens with your white cells. When you have diabetes, they're slow in responding, and then the overall immune system also gets suppressed. So that is how suffering from diabetes before getting coronavirus then increases your risk of getting a more severe form, rather than those who didn't have diabetes. They'll probably get a milder form of the disease. Another pre-existing condition I want to talk about is chronic kidney disease, CKD. So your kidneys are very, very important, and they perform a myriad of functions for the body, from helping you produce blood every day to regulating what we call the acidity of your body. So the acid-base status. The acidity of your body is very, very important. What we call the pH of your body is very important. It helps us regulate the content of certain salts in our body. It does that in conjunction with your lungs. So if your lungs are in trouble, for example, then your kidneys will compensate in regulating your acid-base status or the acidity of your body. So one is like a spare tire. So imagine the lungs are affected by coronavirus, and therefore the ability to regulate the acidity of your body is impaired. Then your backup system, which should be your kidneys, sometimes helps in doing that compensatory correction. You already have a pre-existing condition. You already have problems with your kidney because maybe you suffer from hypertension or you were born with some defect in your kidney. Then that compensatory effect won't happen. So once the coronavirus takes effect, then you're going to suffer a lot of what we call metabolic changes. That makes it very, very difficult in combating the illness. So those with chronic kidney disease, kidney problems, in general, need to be very, very careful. They succumb to COVID-19 or develop the severe form of the illness.
All right. So far you've mentioned underlying health issues that have to do with the kidney, as well as diabetes. And I know there are quite a number of them. But before we even get to that, let me use this opportunity to open the phone lines. So if you have any questions regarding pre-existing conditions and COVID-19, you can call us and speak to Dr. Osafo. Call us on 0302-216-541. That's 0302-216-541. All right.
So another pre-existing condition is people undergoing cancer therapy, chemotherapy. So there are quite a number of people undergoing breast cancer treatment, cancer of the cervix treatment, and so on and so forth. Once you're undergoing chemotherapy, most of the time your immune system also takes a hit, because these chemotherapy agents are very, very powerful, and they don't only destroy the cancer cells, but sometimes your normal cells also take a hit. So you need a period of recovery before. So those undergoing chemotherapy are also another at-risk group. Malnutrition is also another big problem. That
not eating properly.
Yes. So not eating properly can have two main forms. We have the kwashiorkor type where you are not having enough protein intake, and then you have the other type where people are eating too much, of the wrong things. But primarily, your immune system is made up of proteins.
Okay.
It's made up of proteins. So when you have this protein energy malnutrition, as we call it, the kwashiorkor, the marasmus type, the one we know in our part of the world, then you are not taking enough proteins, and your immune system is very, very weak, and it cannot function properly. So malnutrition, unfortunately, in our part of the world is still a big problem. In most developing countries or developing economies, it's also a problem.
Okay, Doc, not to cut you, but we have our first caller.
Right.
We have Joe. Okay, I think I lost Joe. 0302-216-541. That's the number to call us on. That's 0302-216-541. Okay, right. I think I have Joe. Hello, Joe.
Yes. How are you doing?
I'm good, Joe. Thank you for joining us on Drive Chat. I believe you have a question to ask our doctor. Yeah.
Hi, Joe.
Yeah, I have a question. Okay, my question to Doc is the asymptomatic patients, do they recover on their own? Do they recover with time on their own? Or they still have to go through certain medication before they recover?
Actually, the way we describe the asymptomatic individuals, you may not know them, but they have the virus. So what we believe to be happening, and again, it's a novel thing, so we don't have a full understanding of the step-by-step processes of how the recovery even happens. But what we believe is that their immune system is so strong that the disease doesn't manifest. So, for example, if I take your blood right now, I might find malaria parasites in your blood and in most people's blood, but you don't have the symptoms of malaria. It tells us that your immune system has gotten a hold of the virus or the parasite in this case, and preventing it from manifesting. So after a while, we realize that some of them then test negative. It means their own immune system has been able to take care of it. So once they identify them, you are an at-risk person. They would isolate you until you test negative.
Okay, all right. I have Mike on the line. Mike, good afternoon. Okay, I think I lost Mike.
Right. So, I'd like to talk about two more situations. They are not necessarily medical conditions, and they are smoking.
Okay.
Right, smoking. So most people who smoke develop a range of respiratory conditions, from the bronchitis to the cancer of the lungs and so on and so forth. So smoking is one of the conditions, pre-existing conditions or situations, as I call them, that increases your risk that if you get coronavirus, then you probably will get the worst form of it. So that is one of the things I wanted to mention. Some individuals who are on certain medicines like steroids, either by prescription or they themselves are abusing those steroids. So these steroids are important. Sometimes we put patients on it for good reason, but steroids generally reduce your immune system. Most people who are asthmatics, would know about steroids, that they've been put on these steroids before, and therefore they will be an at-risk group. So these are the two other what I call situations that I wanted to talk about. They're not exactly medical conditions, but then it will reduce your immune system and increase your chances.
Doc, quickly, we have a message from Vincent in Adenta. Says, Sammy, please ask doctor about autoimmunity. A friend suffers from that and I'm scared for him.
Right, so those individuals with autoimmune, what we call autoimmune disease, unfortunately your immune system is supposed to identify foreign invaders. But unfortunately sometimes our immune system would identify self as foreign and then attack it.
Wow.
So you end up destroying, for example, your joints, your skin tissue from your own cells. And such individuals, they are also probably at risk, at more increased risk from when they get infected with the coronavirus or getting a very bad form of it. So for them, their immune system is not recognizing self as it should, and then it attacks it. So that is autoimmune or autoimmunity.
Okay, definitely. We don't have too much time to really consume this, so we'll push it on to next week. We'll do part 2 of pre-existing conditions and COVID-19. But Doc, I'm sure those that want to ask, a few more questions can reach you via phone. How can they do that? What's your number?
So, before I give out the number, I just want everybody to know that in your home, the church, the society, at the workplace, there are individuals who have these pre-existing conditions, and it is the responsibility of all of us to make sure that these individuals are protected. You may be young, healthy, without any medical condition. You're also at risk, but let us protect those who have these conditions. I mean, a lot of messages are coming through. So those who want to get in touch, 0501 477 340. 0501 477 340. Or they can come by. We're still encouraging people to come by. And the hospital is not such a feared place. It's not a green zone where we ward it off. But if there is a need for you to come into hospital to get things checked out, please do. So Medina Firestone branch clinic is open, and people can step in and we can have a chat.
Okay, Dr. Yao Osafo is the CEO of Medicas Hospital. Doc, great to have you back. And
great to be back.
Yes, we'll wear the mask like that. All right, so Drive Chat continues tomorrow as well. A big thank you to MTN. MTN is reminding you to choose your own bundle. All right, you can choose your own bundle your own way with MTN Flexi Bundle. Simply dial star 138 hash and enjoy bundles that don't expire. As well as Dole Yogurt. A big thank you to Dole Yogurt. You want to have some Dole Yogurt from Sotikam Ghana Limited. You want to check out the vanilla. It's real nice. Dole Yogurt will leave you wanting more always. And Access Bank Limited, the amazing bank. Access Bank Limited, more than just banking. Time for the news at 5, and Aisha Ibrahim joins me. Long time no see.
A day for you, COVID.